Hello and welcome to this episode of Akrinos Access Live. I'm your host, Eric Matei, joined today by Barbra Dey of Dey Ophthalmic Consulting for a fascinating conversation around a really interesting topic, and that is, the keys to success for the modern OD/MD practice. And Barbra joins us with a wealth of experience on this front, a lot of really great insights. So let's go ahead and jump right into it. For starters, Barbra, hello, welcome to the program.
Well, thank you. I'm delighted to be here with you today, Eric, and looking forward to our conversation.
Yeah. So on that note, let's kick it off. Let's kick it off with really taking it from the top and just helping people understand, when we're talking about a modern OD/MD practice, really, like, what does it really look like? And maybe also shed some light on like ownership arrangements, doctor coverage, specialties, and care modalities and such.
Right. Yeah. So the modern OD/MD practices, there's quite a couple of, there's a few different types here. So we've got the private OD/MD practice that, most of these practices are focused on generating surgery, right? So cataract surgery, maybe retinal surgery, glaucoma surgery, etc. But many of them also will be integrated with an optical department. So we'll have an optical department. We'll also, we'll have our optometrists in these practices who will be primarily focusing on the vision exams, but also a lot on post-operative care from the surgeries generated by those surgeons, right? Typically in these type of practices, they may be in one community, but they may have 3 or 4 locations, right? Spread out across the city or across an urban area. Maybe one location might serve a population, an hour or so outside the city, right? So that's kind of what they look like. They're typically MD owned, right? So
Sure.
I have come across practices where there are OD ownerships in them, but they're few and far between, to be honest with you. It's mostly MD owned in these scenarios. But of course, there are now in the space, we've had a lot of private equity come into that space. So now some of these practices are private equity owned, right? And
Sure.
now it's a very different scenario, because now you might have 50 or 60 locations across, 7 states, right? And so that sort of setup is very, very different. You'd have, your medical board of directors, who are, providing feedback for how things are going and how the surgery site is doing, what's happening in, with the clinical services, who's servicing the patients across these different locations, and are they focusing on private pay stuff in one location, not in another? Have they, expanded the services they're offering, such as, myopia management maybe, or dry eye management, or are we going into aesthetics? That's been a very big thing now in that space. So the PE space is obviously much larger, harder to maybe bring things in and get things streamlined and organized. And also what I've found in that space is that when they're bringing on all of these different separate entities, that they all may have had different missions or values, mission statements or different values, and really trying to bring that in so that they have one unified mission and they have now core values for this new PE. So that's been super interesting to see how that evolves in that space. And a lot to learn there, but it's very exciting time in those practices for sure.
Yeah. So it really is fascinating to see, again, with all these advancements in vision and medical and surgical eye care,
Yeah,
and this radically expanding scope of modern optometry. It's fascinating to see these collaborative practices where you do have a strong OD and MD presence there. So I'm curious, you mentioned from an ownership standpoint, typically ophthalmologist owned. To what degree is there opportunity for optometry and ophthalmology to be in joint ownership? I know here in the state of Louisiana, I know there was a big group practice that grew by leaps and bounds, that had optometrists as part of ownership and what have you. So, you know, help us understand a bit more. From my standpoint, it seems like tremendous opportunity, right? Where you'd have maybe one surgeon and a group of optometrists where everyone can like own this business together and really maximize everyone's skill sets and the potential of everyone's skill sets. But share with me kind of what's going on that front, because you know us, we're all about private practice.
Right. Yeah, yeah. So that's super interesting because what I have noticed, okay, so I do know of one practice that was mostly optometry owned and then just started employing MDs to come into their practice to to generate the, so they would generate their surgical patients and then do the surgery at the local surgical center, hospital, whatever it was. But it was actually the optometrist employing the MD. So there was actually optometrists employing the MD, and the MD was really delighted with that situation. It worked really well for him. I think what you mentioned here, I think there's huge opportunity for actually this dual ownership between MDs and ODs, because they both bring something different to the table, right?
Absolutely.
So the MDs are coming from the perspective of surgery, efficiencies during surgery, adding new surgical services to their repertoire, whatever it is, that are more private pay, because we all know reimbursements are decreasing across the country for everything, right? So we have to be more creative and innovative when it comes to like, what are we going to do, whether it's upgrading the intraocular lenses that are, at cataract surgery. So we have a multifocal IOLs inside the patient's eye, and the patient is paying for that upgrade, right? But then the optometrist brings to this whole side is like, optometrists in most states now can, provide services for dry eye, including, IPL treatments and things like that. So things of those nature. So it's there. And then they also have their optical shop, right? So they can also do that recommendation from the lane to make sure we're capturing in the optical. And I don't think our ophthalmologists think in those terms, right? They don't think in those terms because their mind is on the surgery, right? So when you bring those together in this sort of collaborative business entity, I think there's huge opportunity for both. And I think, picking the right partner obviously is essential, right? You have to be able to collaborate, listen, and then also you have to be able to, give and take. You can't always get your way 100% of the time. So these relationships, like that relationship is so important to the success of that practice, right? But I agree with you. I think there's huge opportunity in that space. And I am seeing it more and more, but it's also interesting because with some of the optometry folks I've spoken to, they're the ones taking the lead now, trying to employ these ophthalmologists within their space so they have more of a say, which I appreciate. I think that's great. It's amazing.
Absolutely. Well, and a lot of it also has to do, if you think of it in the context of continuity of care over the patient life cycle and truly, cradle to grave care of the patient. It's going to include a variety of both, primary care and vision needs, as well as medical eye care and surgical needs. So
correct.
It really is fascinating. And again, to your point, with the proliferation of modern specialties within both areas, right? I mean, modern ophthalmology getting highly specialized, and also modern optometry getting highly specialized. And the opportunity there, the potential there is just it's ginormous. Is that a word, by the way? I don't know.
It is, and it is ginormous. I absolutely agree with you. I think there's some huge potential there.
So now let's get into talking about I guess a bit more of the day-to-day, kind of some of these operational elements, right? Because I know you and I both we're very active out there, active in the online forums, and kind of finger on the pulse of the conversation out there. So let's talk about how these mixed specialty, these ODMD practices are going to differ, particularly as it pertains to patient experience. So these differences across the patient journey in operations and workflows and some of that.
Yeah, for sure. So it is quite different across that patient journey in many aspects, but there's also a lot of similarities, right? So if we take it down to just the basics, the goal for every patient is to provide them with an exceptional patient experience. That's the same whether you go to an MD-OD practice or an OD practice, but it's how you get there, right? In these different practices. And when you have your MD-OD practice, the difference is, well, the biggest difference is in their workflow and the technology they use, right? So when we talk about optometry, most optometrists will have an EMR program, let's say Revolution, EHR, Crystal, Ifinity, whatever one they have, right? And that is used from when the patient checks in, they're examined the lane, their optical purchase, all of the revenue cycle management is done through that. Now, in ophthalmology, they're putting 2 or 3 systems together to achieve the same thing. So that's a big difference. And often what I see is that those interfaces or integrations or the choosing of those products, sometimes it isn't done in a collaborative fashion, and so they may not have the best solutions in place, and that's where the inefficiencies can come in. And so we really need to hone in on that in the MD-OD practice and really look at the technology they're using and make sure that they're not triple order entering. I put it in this system, but now I have to go over to the optical system. I have to enter all the insurance information again, the patient's name and date of birth. It's so inefficient, and it's a poor patient experience because it means more wait times and patients waiting around for the optician to do that data entry. So there's huge opportunity in the workflow to really improve it by making sure all the technology is interfaced for a seamless experience for that patient. So when they get to the optical, the prescription's already there. The optician knows all about them. The recommendation has come through the system to them if they're not doing that personal handoff, right?
Yeah.
I think technology is a huge factor in this workflow for sure. And then other things are, like in the MD-OD practice, like we know in optometry now, we always have this online scheduling platform, which to me is just a no-brainer. We have to do this, right? We want to make it, our goal is to make it easy for patients to do business with us, right? And
Absolutely.
if that means, they want to schedule their appointment at night when their kids are in bed or whatever it is, they have that opportunity. Now, in the MD-OD space, it gets a little bit more complicated because we have to think about if the patient's online scheduling their appointment with the MD, are they scheduling an appointment that MD should be seeing for, does it make financial sense for the business, right? So setting up those schedules for an MD-OD practice can be a lot more complex. And what I've seen is that so typically they restrict it and they may just have the OD schedules up online and they say, this is just for routine exams or routine with contact lenses. If you have a medical issue, please call our office, right?
Sure.
Because they haven't perfected that. And that's something I've seen practices playing around with and trying to do that better, because we know how much time it takes for our patient service representatives to schedule those appointments, get all the insurance information in, all of that. It's a real time, it consumes so much time, right? So we want to make more efficiencies on that side. And we're really working on that on the MD-OD side to make things more streamlined and efficient there. So, and then, the workflow within, going from the check-in position, right? Like the check-in process is pretty similar in both places, I would say. And then the patient journey from the check-in back to the doctor via the technician, most of that is fairly similar. There may be difference in the amount of, or the workup that the technicians do in both spaces. Typically I see in the MD-OD space, the technicians doing more, right? And, so they may even refract the patient, right? So we don't really see that in the OD space. It's very rare at least, but in the MD-OD space, it is more common. And then of course, the OD would come in and still refine and tune in, but I do see technicians taking on a little bit more responsibility in those spaces. And maybe that's an opportunity for optometry down the road, right? That could be an opportunity for them to utilize their technicians more. And then again, a big difference, I think, in the whole operational flow is like, once that exam is done, right? As an optometrist, you are going to recommend, your patient the best visual solutions you believe for their lifestyle, right? You want to make sure that they have everything they need going out in the world, going back to work, playing their golf, or whatever they're doing. Now, and I think for primarily in the optometry space, I think that's done very well. And the personal handoff is, executed without any issue, and it seems seamless, and it's done really well from what I've seen. Now, in the MD/OD space, there is a lot of room to really improve that process. So what I see, and this isn't across the board, but it is pretty common. What I see is the OD is in the room with the patient, and this is an OD working in this space who really is, believes in their, they do a lot of medical management too, right? And that's what they love, and they're doing that. And then they do their vision exams. But they feel their job is complete once they have done the complete health check. They have found everything. You're healthy. You don't have glaucoma. I'm so excited that for you that everything's going great this year. Here's your prescription, and you can go to the optical if you like, right? And so I like to approach that saying, you know what? This patient came into you because they needed visual solutions for their computer.
Sure. Yeah.
And you let them leave in the middle of this exam. That's how I kind of look at it. Like, you didn't complete the circle of care because that patient came to you for something, and you let them go before providing them with the thing they actually asked you for. And so, like, just reframing that whole conversation. And because sometimes the ODs working in these environments feel like, I don't want to sell to the patient. I'm like, you're not selling to the patient. You are recommending what you believe is best for that patient. So when they leave your office, they're going to be bragging about you. They're going to be saying, oh my gosh, he recommended these computer glasses, and now I don't need to go to the chiropractor anymore because I'm bending my neck up, putting on the computer, or whatever it is. But so really reframing that conversation and talking to those OD teams and in different terms so they understand that this isn't selling. This is doing what the patient wants and getting them over to that optical. And ideally, we all know this. If we can bring the optician into the exam lane, it's a win for everybody.
Absolutely. Yeah. You toss out a lot of really great insights there. I think most notably is that there's huge opportunity from an operational standpoint with the integrations, right? And it's fascinating that you mentioned it. Actually, it came to mind. I come across a video recently on, I believe it was on LinkedIn, and something about the some of these costs that practices are incurring in just operations and such. And when you start talking about some of these redundancies in the workflows, Barbara, absolutely. I mean, the opportunity there is big, and it's something that is also typically there's a volume-based component so it can make for almost like an exponential impact, right?
Yes.
And when we look at those typical OD/MD practice, you look at that patient throughput in a given year compared to a independent one doctor OD practice, and it's pretty significant. So those costs start to add up to the organization. Something else that you touched on, which I think is a really great segue into kind of this next little segment here, and I guess where operations really start to meet economics from a revenue standpoint, from a revenue growth standpoint, is what you're talking about with the handoff and with providing visual solutions, like the role of the optical, the role of retail. So talk a little bit about practice economics, right? And mind you, also realizing that it's what is optical today is going to be IOL tomorrow, right?
Correct.
If you think of that patient life cycle with the practice. So share a little bit of your insights regarding, practice economics of the OD/MD practice.
Absolutely. So for economics, for sure, one thing that you mentioned there was the amount of money there's some of these practice spends on employee hours because of inefficiencies in their systems is huge. So from a cost, from even from staffing and cost saving, and actually not only that, from job satisfaction, right? It's not very satisfying for an employee to be doing the same thing twice or 3 times, right? It's actually a real, ugh, it doesn't feel good at all. So from a cost savings perspective, right? I think there's huge opportunity by, introducing these efficiencies in the workflow through technology. I mean, we have amazing technology out there. We're going to reduce costs in with our employees, or even better yet, we're going to open up time for those employees to be doing way more productive work for us, which would be those, that quality time spending with the patient in the seat, in the chair, talking to them about their visual solutions. And then, you're right. This isn't just a one-time deal. These are patients for life. And yes, they're coming in today for glasses, and in 5 years, they're coming in for surgery, right? And being able to introduce those things slowly to your patients on each time you see them or visit with them is really key to the success of those practices, right? So the other thing that's super interesting in the MD-OD space in relation to, the OD space is when you look at the metrics and the metrics for those different practices, the entities, they're different, right? Which is interesting. So in the sense that, like, you set goals, right? I mean, in optometry practices, we want to be getting at least a 60%, maybe 70%, capture rate, right? And if we do it well, we can. When I go to an MD-OD practice, their expectations are a lot lower, right? And so they were like, okay, if we get 50% capture rate, we're really happy. And I'm like, but why? And I'm trying to understand, like, why do you, like, where did this come from and why? But it really truly comes down to, again, that education of how do we, at every touch point on the patient's journey, how do we talk to them about that, what they can expect? Like,
Right.
if the front desk person says to the patient, Miss Jones, did you bring your sunglasses with you today? It sets the thing, oh, sunglasses? Oh, because we have a great new selection in our optical, right? Like, if every touch point is saying something about how they can improve that patient's lifestyle at the end of that appointment through purchasing eyewear or eye care, then, we have a much higher chance of getting them into the optical to capture them, for sure. But then also it's also that patient experience. The patient feels like, oh, they listen, they care, they want to do better for me, right? So even though the metrics are different in both places, I think there's an opportunity for them to be the same, especially when it comes to capture rate, whatever, and things of that nature.
Absolutely.
Yeah,
Absolutely. I really like how you serve that up and put it in the context also of kind of like this, the lifetime value to the patient,
yeah,
right? And notice and to our audience out there, a lot of folks really forward thinkers with how they approach business, with how they're going to approach their practice and practice ownership, right? But when I say lifetime value to the patient, oftentimes we talk about lifetime value of the patient to us. How much money are we going to make off of them?
mm-hmm.
It's important to consider that it's really about that value you provide them, because the more value you can provide them, that's really what's going to determine that long-term relationship, and ultimately impacting economics of the practice by way of
Yes,
revenue.
but also that patient is way more likely to tell their children, their grandchildren, their cousins, their neighbor about your practice when they feel cared for like that. And it's
Absolutely.
kind of like, we all like to go to one place to get it done if we can, right? So because then we don't have to, when you go to the PCP, they might say, okay, well, come back next week for your labs, or you'll have to do this over there. And it's like, another appointment.
Right.
If we can provide this, complete service to the patient in that day or in that moment, like, that's a huge value for the patient, right?
Absolutely. Yes.
It's huge, huge value. What's super interesting as well in that space, Eric, that I think I have to address, because it's something that makes me go, ah. So in the MD-OD space, especially if it's more MD run, they're so focused on the surgical side of their business, which is a huge moneymaker for them. Like, that's where the real revenue can come in, that sometimes they forget about the value and what could be for their optical, right? And the other thing I've noticed is that, so in those spaces, often, like, their leadership or their administrator or their MD collaborative relationship with their administrator, they focus a lot on the clinical and on the surgical side, and sometimes they forget about the optical side, and that's a big mistake, because it can be a significant revenue generator for the whole business, for the total business, and so I think that there's great opportunity there, and in that, like, really collaborating and listening to their leaders in that division of their practice, right? And having the
absolutely.
right person in the right seat there is also essential for the success of that part of their business. And I think that's so important to say. And I see more now, like, people will reach out to me if suddenly they notice there's a dwindling in their optical. Now, they've never really looked at it before in detail. They're just like, oh yeah, it's ticking along, it's doing fine.
Sure.
And then they'll be like, oh, something happened. And then, I'll go in and say, okay, so here's what's going on. And when I have these conversations with the administrator or the MDs, it's so interesting, because they actually don't know a lot about that space, and because they're too busy with the other stuff. And that's, there's nothing wrong or right about that, but it's more like, okay, you don't have to know everything about that space, but you should know these benchmarks, and you should be able to have conversations around what's happening to make sure we're hitting these benchmarks. And then, again, being sure that your people are happy and that this is the right person in the seat, so that it's supporting the rest of your business and growing as the rest of your business is growing. So I think it's so important to have those relationships and really be, have your finger on the pulse when it comes to, are things successful over there? And if not, let's ask questions as to why.
Yeah. So, okay. So now let's take it a little bit further. By the way, a fascinating conversation here, Barbara. Really, a lot of really great insights out there around, these keys to success for the modern OD/MD practice. And now, as we're kind of starting to wrap things up, let's maybe talk about, share what viewers could do today in their practice if they want to take control. What are some of these, kind of, where can they start to really start to, like, dissect things in their practice?
So I think, again, like, looking at your leadership team, I think you use your people and you listen to them and you ask questions. I think that's where you start. I mean, you need to look at your data, obviously, and your data can drive some of those questions, right? To find out, okay, where we are. And then the other thing that I actually think is really important, Eric, is if you have a fresh set of eyes looking on something, right? We all know when we're in business, and today it's like more prevalent than ever, everybody is scrambling. People are short employees. They're doing their best to keep their head above water, just doing their job today, right? And so when you're in that situation, you don't have time to keep on top of the latest thing in, what's happening in optometry, what's happening in ophthalmology, what is the latest technology? Should we think about this, bringing on this new service? Should we have, like, a robot doing our, EOBs, for, our vision plans? Should we be on this vision plan? Are we making money with this vision plan? They do not have time to look at that stuff. They just don't. And so for me, I think it behooves the practice, it behooves the business to bring in a fresh set of eyes who can dissect it and feed back the information in a way that they can understand, and just give them a roadmap on how to change, or what really, like, what's the priority here? Here's number one priority. Let's work on that first. Here's number two, and just break it down into little small chunks so it's not overwhelming, but we can actually see progress as we move forward, right?
Yeah,
so
absolutely. And I think you hit the nail on the head there, in that let's face it, in any organization of any size, at any stage of the life cycle, there can be a myriad of things going on, a myriad of opportunities. Well, I always speak of the opportunities, but at times those opportunities may simply be the opportunity to, remove the shackle from something that's constraining the organization. But truly, wherever that opportunity lies, at any given time, there's a lot of them. And it all ties back to, really, what is that, as we like to say, I like to say bandwidth for change, right? Like, how much can you address at one time?
Yes.
But the importance of being objective, and I think that's something else that you mentioned there, right? You really got to dig into your numbers and be objective about it. And that's where fresh set of eyes, you want to talk about objective assessment. And I know particularly with established practices or,
Yeah.
in practices that may have a group of owners,
Yes.
multiple owners,
Yeah.
oftentimes this stuff, the way we've always done it gets in the way, egos get in the way, a whole myriad of things. So
Yeah.
fascinating insights here. Well, for those of you just joining us, I hate to say it, but you're going to have to go back and watch it from the beginning. But we've been hanging out here with Barbra Dey talking about keys to success for the modern OD/MD practice, and she shared a lot of really great pearls. Again, applicable to optometrists, ophthalmologists at any stage of the practice life cycle in these sorts of practice environments. So, Barbra, as we kind of wrap things up, why don't you share a little bit about yourself and the type of work that you do with your business, Dey Ophthalmic Consulting?
Sure. Yeah. So I've worked in the eye care space for the last almost 30 years. Graduated from optometry school in Dublin in Ireland, and then did a lot of traveling and worked in different countries, which actually is super cool. I spent a year in Australia working in optometry. I've been all around the UK, and then ended up in the States. And I actually worked in the MD space for, I think, about 15 years, and so really got a great insight in how, and the space I worked in was MDOD, right? And so really got a great idea of like the MDOD relationship, co-management, that whole space. And then I moved to optometry to run an optometry practice. And I did that for almost 10 years. And that was a totally different experience. So I will say to you, the MDOD space is quite different to the OD only space.
Sure.
And there's so many things you can take from one to bring to the other to help those spaces out. So having that great understanding, I like to go out to my clients, and I do a lot of those, evaluation. Where are we now, and what can we do to grow our practice, right? I do a lot of those type of evaluations. The other thing that I really enjoy and I love to do is really evaluating the OD-MD relationship, right? So in a lot of these MD-OD practices, the MDs are doing their thing, and they would have, they're on the ownership board or, working with the administrator on different things. But sometimes I feel like the ODs, they don't have as strong a voice as they might like in that practice. And so I really like to come in and say, look, so who's in charge of the ODs? No, like the MDs are. Okay, but do they have meetings where they actually talk and say what they need or what they would see as being successful within your practice? And they're like, not really. Okay, so let's work on this OD-MD relationship and make sure that their voice is being heard and that their ideas are being heard. And then on the other side, also, let's make sure they're being held to account for their behaviors within the practice too, because
Absolutely.
It's a two-way street, right? And so that's a really enjoyable part of the practice, and really listening to what people's roadblocks are and struggles. So I really enjoy that. I mean, the other thing I help them with is career pathing, because we know it's so hard to get good people on board now, especially trained opticians, right? That is really difficult.
Yes.
And so bringing in, hiring for personality and training for skill, I truly believe in it. I really believe in it. And then showing these young people or whoever we bring in, this is a career, and you can go from A to B to C, and look at what happens at C, and really showing them not only like from a knowledge perspective what happens, and then from a financial perspective where they can get to really get them to buy in to the career and become career opticians, because we need more of them. And so I love doing that. I really enjoy that space too. So lots of different things. Sometimes I'm called on to help with their co-management programs, and lots of different opportunities, and each one is just as much fun as the other.
Fantastic. Well, how can folks get in touch with you?
Oh, they can get in touch with me through my email, which is just my full name, barbraday@outlook.com. I'm also on LinkedIn, or through my website,
which is deyophthalmicconsulting.com.
Yes, exactly.
Fantastic. Well, Barbra, thank you so much for joining us here on Akrinos Access Live for what has been a really, really insightful conversation all around the keys to success for the modern OD/MD practice. For our audience out there, viewers coast to coast, If you're looking for more great practice management insights like this, check it all out at Akrinos.com. Subscribe to the Akrinos YouTube channel and follow Akrinos on the socials. And on behalf of our team here at Akrinos, Dr. Barbra Dey, thank you so much for joining us
Thank
here
you, guys.
on Akrinos Access.
That was great. Thanks a lot, Eric. Take care.
Absolutely. Until next time.